TILLS, the Test of Integrated Language and Literacy Skills, presented by Jennifer Duncan, Lauren English, and Leah Gardner. The Test of Integrated Language and Literacy Skills, or TILLS, is a diagnostic tool used by clinicians to assess oral and written language skills. A secondary goal of the test is to assess what role memory plays in a student's academic performance. It is a norm reference assessment that has three primary purposes. Number one, it helps identify language and literacy disorders. Number two, it provides insight on a student's patterns of language and literacy strengths and weaknesses. This information will aid clinicians in formulating intervention next steps. And number three, the TILLS tracks any changes that takes place over time, typically in 6-month or longer intervals, regarding the client's language and literacy skills. So how does the TILLS work? The TILLS consists of a series of 15 subtests in a variety of language and literacy areas that can provide a complete picture of a student's oral and written language skills. This assessment can be administered as a whole, by individual subsets, or a combination of subsets. Testing can occur in one session or over a period of time. And typically the professionals who administer the TILLS are speech-language pathologists, special educators, learning disability specialist, neuropsychologist, educational psychologist, or reading specialist. So who should be assessed with the TILLS? This assessment is suitable for any student between the ages of 6 and 18 and who may have a specific language impairment, learning disability, specific reading disability, or dyslexia. Administering the TILLS may also benefit anyone within that age range who struggles with language, literacy, and/or social communication skills. As previously noted, the Test of Integrated Language and Literacy Skills includes 15 subtests. The entire list is shown here. I'm just going to list a few though. Included are vocabulary and phonemic awareness, listening and reading comprehension, and digital span forward and backward. So this is a diagram that we wanted to include. I thought it was a really great diagram that the authors of the TILLS put together. They created it to show that the 15 subtests were designed to assess the different language dimensions across 4 different language modalities. And they also included memory here as well. So the language dimensions include sound and word levels and sentence and discourse levels. And then the 4 language modalities are listening, speaking, reading, and writing. And so the purpose of this diagram, according to a Q&A session with the authors, was they hoped that it would allow the users of the assessment to be able to kind of pick the subtest that they feel would most benefit their client or the student that they're going to be assessing. So Leah is going to speak a little bit and describe a little bit of how the test is actually administered.
So now I'm going to explain a few of the subtests. Subtest 1 is vocabulary awareness. For this subtest, the clinician will open the stimulus book and will say, here are 3 words. Let's read them together. Dog, cat, bone. Then the clinician will say, tell me 2 words that go together, and then ask why. An appropriate response would be dog and cat. Both are animals. After the first response, the clinician will say, now can you tell me 2 other words that go together in a different way? An appropriate response would be, dogs like bones. If the responses are appropriate, the client receives a score of 1. But if the responses are inappropriate, a score of 0 is given. Subtest 6 is listening comprehension. The clinician would start off by saying, I'm going to read some short stories. Pay careful attention because I'm going to ask you some questions. Tell me yes if you are sure the answer is yes. Tell me no if you are sure the answer is no. If the story doesn't clearly tell you the answer, tell me maybe. An example story would be, Teresa has a gray and white kitten that likes to play with string. The kitten's name is Fluffy. Question 1 asks, is Teresa's kitten black? and the appropriate answer would be no. Question 2 asks, does Teresa have a dog? The appropriate answer would be maybe. If the responses are appropriate, the client receives a score of 1, but if the responses are inappropriate, a score of 0 is given. Subtest 11 is reading fluency. The clinician would start off by saying, here are some facts that tell you a story. Read the facts. Just read words you know. It is okay to skip the words you do not know. In the example of the little dog, if the client read the first line and said, there went a dog, the clinician would mark through the word was, and the client would receive a 3 out of 4. In subtest 14, digit span forward, the clinician starts off by saying, I'm going to say some numbers. Listen to the numbers, and when I'm finished, I want you to repeat them back to me. In the stimulus example, the clinician would say 4, 2, and the client must repeat back 4, 2 in order to get a score of 1. Incorrect responses receive a score of 0. And now Lauren is going to explain how scoring works.
So these are the scoring procedures for the TILLS. Number 1, you will transform raw scores to standard scores. Number 2, you will obtain percentile ranks to provide another way of putting the student's raw score on a standard scale so that it can be compared easily to the normative sample. Then you will calculate the TILLS identification core scores. Number 4, you will calculate composite scores. 5, you will calculate a single standard score and percentile rank for the TILLS total score. Finally, you will determine the confidence intervals. After scoring the TILLS, you will receive the following scores: standard scores, percentile ranks, the TILLS identification core scores, the TILLS sound/word, sentences/discourse, and oral and written composite scores, the total standard score, and confidence intervals. As you can see, sensitivity and specificity were calculated for each age group that was tested. As we all know, sensitivity refers to how accurate the test is in identifying students with a known disorder as having the disorder. Specificity refers to the test's ability to rule out the disorder among students who show no other evidence in showing the disorder. In each age group, sensitivity and specificity were above 80%, with specificity being 100% for 8-year-olds and 12-year-olds. We believe that the TILLS is highly effective because it provides the examiner with an accurate diagnosis. We know that the diagnosis is accurate for the following reasons. It is the only assessment that tests sensitivity and specificity across the full age range of the test. The sensitivity and specificity across all age ranges are also above 80%, proving that the TILLS is clinically useful. And the results are provided in age bands that are meaningful to language and literacy developmental milestones. This is particularly helpful when treating school-age children. The overall effectiveness is one reason for choosing the TILLS when assessing a child suspected to have a language disorder. Other reasons include the following. First, it is a single comprehensive tool to help with language assessment process. In this one test, it is a streamlined assessment, it monitors progress, and it can also improve students' communication skills to facilitate success in school. It can also be administered in 90 minutes or less. It is very flexible due to the fact that all 15 subtests can be administered, or only those subtests pertinent to areas of concern can be administered, and this is depending on the student that you are assessing. Finally, progress can be easily tracked, which is a good thing for us to assess them later on. And here are our general impressions of the test. These are listed in pros and cons. For pros, it evaluates many areas of language and literacy, as you could see in the 15 subtests, and it is also useful for school-age children. The cons can be that it is lengthy, it is difficult to score, and it may not be engaging, particularly to small children. Thank you for listening.